Hello. Welcome to Physician Hospital Alignment. How can I help you?
Hello. I'm a mental health professional.
I'm sorry. You're not a physician?
No. I'm a mental health professional.
Oh,
Can you help me? I have a question.
well. Okay, I'm not sure I can help you, since you are not a physician. What is your question?
What is the physician hospital alignment?
Why do you ask?
Well, some of my fellow mental health professionals are joining the physician hospital alignment.
Why are they joining? They are not physicians.
I'm not sure why they are joining. Most mental health professionals don't like to join anything.
I see. Do you want to join?
I want to join. The physician hospital alignment sounds important. I want to be part of something important. Who are you looking at?
No one. Let me see if I can answer your question. The Physician Hospital Alignment seeks to support the objectives of the Triple Aim.
What is Triple Aim? Can I join Triple Aim?
Why do you want to join the Physician Hospital Alignment if you don't know the purpose of Triple Aim?
I thought if I joined it would help me get referrals, and I would be part of something important.
You cannot join Triple Aim. It is not a club. You can join the Physician Hospital Alignment. But you are not a physician and you are not part of the hospital.
So, what is Triple Aim? I'm confused.
The Triple Aim is our hospital plan to improve the patient experience, reduce costs, and improve the health of the community. Triple Aim is our effort to create an accountable healthcare organization under the Healthcare Reform Act. We have to do this since a lot of our money comes from the federal government. The government will give us bundles of money and we get to keep what we don't spend.
What is an accountable healthcare organization? I think sounds important.
An accountable healthcare organization is a shared collaboration that integrates providers into statutory entities that share quality-driven bonuses and upside risk that is generated by beneficiaries statistically selected on the basis of past utilization patterns.
I have no idea what you are talking about.
My hospital and physicians will try to save money for insurance companies. If some cash is left over, we will give some back to our physicians and their point of health care.
I'm not sure I can trust the insurance companies.
That is why the government is in charge of all this.
I'm not sure I can trust the government.
That is why we have lawyers involved in running all this.
I'm definitely sure I cannot trust lawyers.
Well, the hospital is in charge of the lawyers.
I'm not sure I can trust the hospital.
That is not a problem, because this is also physician-directed.
I'm not sure I can trust the physicians. Will mental health professionals direct mental health services?
No. This is physician-directed.
Can you tell me how you are going to save mental health dollars, and who will get cash back for saving that money?
Behavioral health is one of a dozen points of health care. There will be points of health care like cardiology, oncology, hospice, home health. In your case, our hospital intends to reduce utilization and cost when physicians refer to our hospital's behavioral health clinic. Our behavioral health clinic is accountable, and it is an integrated model. Our behavioral health clinic can provide services at a lower cost than an independent mental health professional can. This could drive down the cost of mental health services in our community.
But this will drive very qualified and experienced professionals to limit their practices or stop seeing difficult patients.
Yes. That is an unfortunate risk.
Will you refer patients to me if I join the physician hospital alignment?
Do you have an interoperable charting and patient database that can provide a secure data feed so that we can identify utilization patterns, high-cost outliers and manage proactively elevated utilization patterns and outcomes?
No. I mostly keep handwritten chart notes.
That's not good. Is this a common practice?
Yes. Most of us avoid technology. We find that it can be dehumanizing. So how will I get referrals?
Well, I don't know. I do not think mental health professionals have an accountable health care and integrated delivery model. Do you employ evidence-based practices?
Well, not exactly. But I help a lot of patients. They refer their friends and employees to me. And their physicians refer to me because they believe I do a good job and care about patients.
So, your effectiveness is based on undocumented subjective anecdotal reports. Do you collect data to help you understand and manage outcomes?
No. I just use my clinical experience. So, how can mental health professionals get referrals?
I'm not sure. Physicians will want to reduce utilization, save insurance company money, and get money back. And many physicians think behavioral health is just hand-holding for people who are just lazy.
I don't understand. You are telling me that physicians and hospitals will make money if they can reduce the amount of money spent on mental health?
Yes. That is possible. And if we can standardize treatment, we can create better outcomes?
What? You can't know that. The research suggests that it is the therapeutic relationship that predicts change, and that the standardized treatment is not sufficiently robust to treat all people with similar presenting symptoms the same way. Different modalities of treatment are equally effective when delivered by qualified professionals. A standardized treatment can be delivered by any idiot. And the patient will not have much confidence in an idiot who is imitating a mental health professional. The type of therapy must be aligned with the personality of the patient in the context of their life and their resources and their current circumstances.
That's interesting.
If physicians limit and hospital administrators try to control care, then mental health professionals will be responsible for the bad outcomes, and then there will be an increase in patient complaints against mental health professionals. I'm worried that the value of my services will decline if physicians direct mental health care.
Well, yes. Mental health professionals will be responsible for the risk. Bad outcomes will be their fault.
Why are you rubbing your hands?
Was I?
Yes. Never mind. Are there laws to prevent this?
There are stark laws, antitrust laws and anti-kickback laws. These laws are supposed to prevent inside deals and prevent people from giving special favors. Accountable healthcare organizations are supposed to improve community health. We can save and make a lot of money if we manage things right. But this is also complicated that no one knows how to audit these shared collaborations and referral agreements. Our hospital's board of directors would be very worried if they knew about the risk of inside deals, kickbacks and risk for antitrust violations.
That sounds like a high risk for fraud and corruption.
I can tell that you don't know much about this. It's complicated.
You think? I still don't understand. How does joining the physician-hospital alignment help mental health professionals help the community?
I don't know. The goal of the alignment is to benefit patients. But there are benefits to physicians who join, not mental health professionals. You are not a physician.
You keep saying that. But no. I guess I don't know. What is an integrated delivery system model?
I'm sorry, but you are really pretty clueless.
Well, it seems that the physician-hospital alignment will benefit hospitals and physicians. I don't see how it will help my patients. The physician-hospital alignment sounds like a capitated healthcare system that will generate profit by denying services to mental health patients, and especially those patients with serious and recurrent mood and mental disorders. Healthcare is centered around the physician office visit. It sounds like the goal is to spend time and money managing care. But then there will be less money left to provide services. I think the hospital will control information and it will give them power. And people will make a lot of money and you will drive down the cost of an hour of therapy. The money will be used to hire and pay administrators big salaries.
It sounds like you are not familiar with healthcare reform.
No. You are right. I really prefer to see and help patients.
Okay. May I offer you some advice?
You are going to say that mental health professionals better figure out how to provide services in the new age of integrated and accountable health care. And if mental health professionals don't start to run their world in the face of healthcare reform, physicians and hospitals will end up running our world for us.
Yes. You're good.
This is really distressing. There is little chance that mental health professionals will collaborate, hire qualified healthcare consultants, and invest money to develop an accountable and integrated service delivery model that we can all use. We prefer to see patients and many of us do not trust our colleagues. We value patient privacy more than physicians do. We are not proactive. We are very reactive. And we complain a lot after something bad has happened that could have been avoided. Our income is going down, while physician income is going up. My mental health community also has a number of self-serving individuals who are very, very narcissistic.
We have same problem with physicians. Say. Did you say you keep handwritten chart notes?
Yes.
I'm wondering. Can you be my therapist? I want to wash my hands all the time. I do not want to see someone who is in our hospital behavioral health program. Our hospital has had a lot of IT violations lately.
I can refer you to someone who is very experienced with those issues and respects privacy.
Thank you. You seem to care more about patients than you care about healthcare reform.